Discharged from the hospital? Don't make these common mistakes. Discharge planners are not always preparing patients to leave the hospital. Sometimes it's very sudden, and when you can prepare in advance, it makes the process from hospital to home much smoother and less stressful. My name is Betsy Miller with Home Instead in Orange Park, Florida. And today we are going to talk about how to have a successful discharge from hospital to home. Number one, create a plan. Doctors are focused on what they're doing. They're not always thinking about the things outside of the hospital. Secondly, it's patient choice. So sometimes you might feel pressured by maybe the agenda of that discharge planner or an assisted living or rehab. But remember that it's always patient choice. And Home Instead, we are a third party. We can help guide you through some of the choices that are available to you. In healthcare, people have a tendency to just blindly trust what a care professional is telling them without looking for other options. Discharge planners are sometimes operating really quickly because they're put under pressure to meet their goals and their demands for their job. Home care is an independent third party, and it's always good to have an advocate, someone that can guide you and help you to make these decisions. Many times, families and loved ones have never been through this situation before. So it's great if you could get an assessment ahead of time before your loved one, yourself, or your family member is discharged. Number two, build your team. Your team can include people such as your entire family. Different family members can be points of contacts, such as someone responsible for the financial aspect of the care. Another family member might live close by, so that might be your emergency contact. We also want to make sure the doctors are involved. So if a home care agency or another home health provider is in the home, they're able to quickly reach out to that doctor and get advice depending on the situation. And that brings me back to the home health services, the skilled care, that many times, if you've been in the hospital for an extended amount of time, you will get these services provided through Medicare. And those include things such as physical therapy, occupational therapy, RNs to come and check in with you every so often for a period of time. And the last part of the team is home care. And that's what a company such as Home Instead does. We provide what's called personal care, which includes bathing, dressing, grooming, incontinence care, and also the basic home helper tasks, such as just basic light housekeeping, meal preparation, transportation, things of that nature. To have the most successful discharge, both the family, the doctor, the skilled care, and home care should be working together to provide you with that continuity of care. Number three, medication management. This is a very important aspect of the discharge planning process because without proper medication, that's one of the top reasons people are rehospitalized. So it's important to make sure that you have an up-to-date medication list, that the entire team is aware of any changes, who's going to manage the medication. Are they put into pill boxes, which is by far the easiest, most efficient way to do things? And how will it be managed? Through the pharmacy. Sometimes they have where you can do mail order. Who's going to pick up the prescriptions if it is at the pharmacy? And then again, reiterating that pill box as well. So how can a caregiver help with medication management? Caregivers provide medication reminders. So the caregiver would remind the client to take the medication based on the medication schedule in the home. So if it's first thing in the morning before they eat, right before lunch, or before bedtime, we can document that information and provide that to the family and the doctor to make sure that they're following their schedule. Number four, safety and equipment. This is one of my favorite areas to talk about when it comes to home care and discharge from hospital to home, because there are so many wonderful new ideas and options available to make people comfortable at home and to improve the outcome of their discharge and their recovery process. So one idea, which is very basic, is grab bars in the bathroom, preventing fall risks. We're looking for loose rugs on the floor. When it comes to ramps and some other types of modifications like grab bars in the homes, A home care company is a great resource to recommend companies that can do this for you and your family. Assisted devices such as wheelchairs, travel wheelchairs, sit-to-stand devices, and there's lots of other unique equipment that you can find on Amazon. You just need to find a professional that kind of knows about these new inventions and where to buy them. Nice to haves that people might not even think about are baby monitors, so that you can hear your loved one in the home. I guess years ago it used to be a bell, and today it's a baby monitor. A bedside commode, blood pressure equipment, lift chairs, scooters, transfer boards, specialty pillows, and the list goes on and on. And some of the caregivers that are in these homes day in and day out have come up with great ideas that aren't even like official equipment. It's just better ways to use just everyday at-home items to help your loved one make their transition to home and the recovery better. Number 5, preparing the home. It's always nice when your loved one can come home from the hospital and their home is nice and clean. There's food in the refrigerator. It just is just a nice feeling to know that you're coming home to your home and that's where you want to be. So a caregiver from a home care company can help you with those light housekeeping type of chores and really anything you need to make that home feel like home for your loved one. Number 6, get support. This is really important, and anyone who has been through this type of experience before will tell you that during these times, if you are a daughter or a son, you want to spend time with your loved one being a daughter or a son, not 100% a caregiver, because you will burn out and it's stressful. So I highly recommend that you lean on professionals and people in the industry, such as a home care company or a neighbor or other people that can help you during this time. So again, don't be afraid to get support. There are people out there willing to help you. To learn more about working with us, go to our website, www.homeinstead.com/193, or Google Home Instead, Orange Park, Florida.